I think as palliative care is becoming more disseminated across the country and really across the world, people are recognizing that really a lot of what people have been doing all along is technically palliative care, is technically for, say, a pulmonologist who's been following a patient with cystic fibrosis for decades and trying to help them understand what their illness is, be ready for those changes in their clinical care, address their symptoms of difficulty breathing, problems with their GI tract, all of those things. So I think whether people recognize it or not, or call it palliative care, it's very much in the framework of what pulmonologists do. But now we have more tools in our toolbox that people can use to be intentional about learning those primary palliative care skills, as well as recognize when there are more complex decisions or support that is needed for a patient or a family that maybe getting specialty level palliative care makes sense. So I can certainly speak to the intersection of sort of pulmonology and lungs as well as sort of palliative care. And I think there's a lot of intersection, and there's still a lot of room to grow and explore what that intersection and overlap is, given that both are relatively small communities of people who are clinicians in pediatric pulmonology and pediatric palliative care. I think of a lot of pediatric medicine involving pulmonary medicine. I think many parents probably speak to their experiences of coming to see doctors for coughs, colds, difficulty breathing, pneumonias, what it may cough, asthma, just very typical things. So the idea of lung disease or lung issues coming up for children is very, very common. And I think as whether it's primary lung diseases, so for example, things like cystic fibrosis, sort of a genetic disease that manifests with significant lung disease, or other illnesses or constellations of symptoms that families have. So say children with alterations to their central nervous system and sort of neurologic impairment may have a lot of symptoms related to their lungs as well. And so there's a lot of opportunity in thinking about how do we care for families as their illnesses progress and patients as their illnesses progress and become more severe in many respects, in thinking about their symptom management, in helping them through decision making, in outlining and defining what their goals of care are, to helping them cope with sort of the illness and everything that comes along with that at home and supporting their strengths. And so I think personally that's where I've seen the overlap, is in not just one population, but in lots of populations of patients that I see. There's certainly aspects of palliative care that can be brought in.